This is Dr. Nagabhushan, consultant cardiologist in Apollo Specialty Hospital in Nellore. So today we are going to talk about regarding Inclisiran, which is a recently invented drug and being approved by the FDA. It's being used nowadays more frequently for reducing the cholesterol levels. So we are going to talk about a few minutes about this Inclisiran, and we'll start with this presentation. So we know that in the Indian scenario, there is a lot of cases are being increased about atherosclerosis diseases, particularly myocardial infarction. For prevention of this, one of the risk factor we will be avoiding is cholesterol levels. So in that particularly LDL-C levels, which is very crucial. So there are few studies where it indicates that 40 milligram per deciliter decrease in the LDL levels is associated with reduction of 21% reduction of the cardiovascular events. And these are the guidelines which says that the levels of LDL which we need to reduce, particularly in high risk patients. If you see in 2023 ESC guidelines and CSI 2023 guidelines, says that the LDL reduction is to be less than 55 milligram per deciliter, and in a patient who are having second cardiovascular event, so within 2 years, then the goal is less than 40 milligram per deciliter. And according to ACC 2022, even in these guidelines also, the LDL levels should be reduced to less than 55 milligram per deciliter, and it should be reduced at least more than 50% of the target levels. According to Indian Lipid Association 2023, so here also shows that a very low level of LDL-C reduction is required. So a little change in the target levels. So 55 milligram per deciliter in a very high risk group, and in an extreme risk group in category 1 reduction, it is recommended to reduce to less than 50 milligram per deciliter. It's an optional to reduce less than 30 milligram per deciliter. In category B, to reduce less than 30 milligram per deciliter. So in that scenario, we need to reduce the LDL levels. So based on how much amount we need to reduce, these are the targets, particularly in these cases. This is one study which shows that the LDL levels need to be reduced. Though the LDL levels are reduced very low levels, but still particularly synthesis of steroid hormones and bile acid production is preserved. So if you see Inclisiran, this is RNA interference, small interfering double stranded siRNA. So it contains two strands. One is sense strand, other one is anti-sense strand. So both the strands attached to galacto-NAC conjugate protein. So this is the slide which shows that you can see on the topper edge. So this is my cursor, you can see here. So where the two sense and antisense proteins are present, this is galacto-NAC protein. So this attaches to this acylogalactoprotein receptor, so which is being absorbed into the cells, where the RNA induced silencing complexes attach with this Inclisiran. So where the antisense and sense strands were separated, and these get attached to the PCSK9 molecule by mRNA, which is being synthesized by the nucleus, and with the help of this complex, the PCSK9 is being degraded, the mRNA being degraded, because of which the production of the PCSK9 is reduced. So in turn results in decreased absorption of LDL receptor into the cell. So because of that, a lot of receptors are present over the surface of the cell, so which lead to a lot of absorption of LDL level. Uptake will increase, due to which there will be serum levels of LDL-C levels is being reduced. So this is the mechanism of Inclisiran. Indian approval. So mainly this is being used in inclisiran uses. Indication one is in primary hypercholesterolemia, then in combination with statin or where the targets are not being achieved. So it can be used even alone. Also, it can be used for reducing the LDLC level to achieve the target. So inclisiran suitable patients, particularly those who are atherosclerotic cardiovascular disease patients who are at high levels of LDLC levels, remain inadequately controlled with the standard lipid lowering drugs, particularly as I mentioned, statins, ezetimibe, and bempedoic acid. It is also being used in heterogeneous familial hypercholesterolemia. Um, so this comes in a vial which contains 300 milligrams of inclisiran sodium. So out of which 278 milligram of inclisiran will be present, which is a pure form. And these need to be given in divided doses. The first dose, the initial dose. Then after 3 months, we'll give the second dose. Then after 6 months, we'll give the third dose. Then after every 6 months, we can give the inclisiran dose. So it will be maintained. Suppose if we miss the dose, if for example, if we miss the dose in less than 3 months, so we can give inclisiran and we can continue the routine schedule. If we miss the dose for more than 3 months, so then we need to restart the regimen again. Then we need to give again after 3 months, then followed by 6 months. So this is like similar to PCSK inhibitors, so which is a monoclonal antibody. So inclisiran can be administered immediately after the last dose of monoclonal antibody PCSK9 inhibitor to maintain LDLC level lowering. It is recommended that the inclisiran is administered within 2 weeks after the last dose of monoclonal antibody PCSK9. So as I said previously, so those patients who lipid targets are not being achieved. So if you see here in the box where the LDLC level is still more than 55 milligram per deciliter. So we'll add with PCSK9 inhibitor or inclisiran. This is nice guidelines. So here also it says that. So we'll start with inclisiran, where all the guidelines, most of the guidelines, they'll say that initially they'll go with statins and ezetimibe and bempedoic acid. So if still it is not being controlled, then we'll go with inclisiran. So here also the ACC guidelines also say tells the same thing. So the main inclisiran is being studied by Orin group of studies. So particularly Orin 9, Orin 10, and Orin 11. So where they included selected groups, particularly the Orin 9, which includes heterogeneous familial hypercholesterolemia patients, and Orin 10 study where they included atherosclerotic cardiovascular disease patients. And then in 11 they included disease patients as well as risk equivalent patients as being included. All the three they are given the dose of inclisiran has been given, and the time period was 18 months. Present they are completed. So all the studies they say that so they are compared with the placebo, and it's a double-blinded study and randomized studies. So they compared with inclisiran with the placebo, and they said that it is better in safety. Also, it is good, except that skin rashes. So they also said that so inclisiran is more effective and in reducing the LDLC reduction levels. If you see 55.5% sustained LDLC reduction is seen, and so this is a very good drug. Along with that, according to Orin 10 study, where inclisiran reduced other than LDLC level, it also reduced total cholesterol levels. In this slide, you can see 33.6%, and apoprotein B, which is considered as an early risk factor. So it is also being reduced to 44.8%. Non-LDLC level cholesterol levels, it's reduced to 47.4% has been reduced. Triglycerides has been reduced. Lipoprotein A up to 20% it has been reduced, and HDL levels has been increased in 7.5%. So it is a well tolerated proven safety up to 6.8 years of exposure. according to Arni 8, which is an open labeled extension trial of Arnin 3, 9, 10, and 11 of 3,274 participants were assessed in a long-term efficacy and safety, which clearly suggests that it is a better drug. And inclisiran, particularly, it acts in the cytoplasm of the hepatocytes, so it's not acting in the nucleus. So it is mainly less or no risk of carcinogenicity or immunogenicity. So all the trials, most of all the trials, particularly the recent one, 9, 10, and Ornin 9, 10, and 11, they say that it is a very good drug. There have been significantly reduction in the MACE rate when compared to the placebo over 18 months, and it's directly like proportional, so it's a very important drug. And Orin 8, Orin 4, sorry, and other new studies, the still studies are going on. Their expected date end on 2026 and 2027. But as per now present data, till now the study shows that it's a very good drug and decrease in the LDLC levels and MACE rates.